So Student Disability Services is part of campus and student life, and we are responsible for providing accommodations for any student who has a disability, be that a mental disability, psychological, a physical disability, or a learning disability. So we want to make sure that all students have the ability to participate fully in all the programs that the university offers. So if your student has a disability, has received accommodations in the past, perhaps had an IEP in high school, they will want to come and contact me. There's a difference between being in high school and receiving accommodations for disability and being in higher education. On the higher education level, a student is responsible for self-identifying as having a disability. That means the university is not obligated to seek out students who have disabilities, but if they want to use accommodations, they need to come and self-identify and let us know. We also encourage students to do that as soon as possible if they haven't already reached out to our office. The process can take up to 10 weeks. It rarely takes that long. We usually try to turn these evaluations around within a couple of weeks, but depending on the nature of the disability, the complexity of the accommodations that are being requested, and the documentation, it can take up to 10 weeks. So if your student has a disability or thinks they may have a disability, we do encourage them to contact us as soon as possible. It's a very simple process. It's an interactive process. They would need to come to Student Disability Services and self-identify saying that they have or they think they have a disability, and they would then provide me with all of their documentation, and I would explain to them exactly what I mean by documentation, the kind of testing and other forms that we would need from them. We'll review all of that information internally, and then we will also send our report to an external consultant. After we receive their report, we will then determine what accommodations would be most appropriate in that situation, and that's why the process can sometimes take a few weeks. Once approved for accommodations, we would give the student a letter. The student would then provide that letter to all of their faculty members, or whichever faculty members they wanted to provide it to, so that the faculty member knows what accommodations they're eligible for in the classroom. Or we would provide the accommodation letter to housing if it's an accommodation they need within the house system, or to dining services, or whatever relevant party is involved. The key thing to remember about this process is that it's an interactive process. So once the student sends me their documentation, we determine that they're eligible for accommodations, and we give them this letter. That's not necessarily the end of the process. We hope that the student feels comfortable coming back and discussing with me, hey, this accommodation's working really well, it's great, but this one in this class isn't working very well, and we can reevaluate. If the student's condition changes and they need us to reevaluate their accommodations, we expect them to come to us. It's not like the door closes just as soon as they get that accommodation letter. We're very open to working with them on an ongoing basis. We assume that over the course of 4 years, things may indeed change, and they may need to have those accommodations reevaluated at some point. There are 2 full-time staff members in our office. There's the director, Gregory Moorhead, and myself. I'm the associate director. Your students will come and work directly with me. I'm it. So I work with all of the college students. Greg works with the graduate and professional students. So my contact information is here. I also have a card over there if you want to be able to contact me. And I just wanted to note really quickly before I finish that our office has just recently moved. About a week ago, we moved into a brand new office. It's incredibly accessible, it's lovely, and it's right across the street from the Ratner Athletic Center. So if you're looking for us, that's where we are. We're in the parking garage. It's really not as horrible as it sounds, but we're in the parking garage right across the street from the Athletic Center. Thank you.
Good morning. How are you? Welcome to the University of Chicago, and welcome to your students. We're delighted you're here. I am Alex Lickerman. I am the Assistant Vice President for Student Health and Counseling Services, and what I want to do in the next hour is share with you the information about the services we provide in Student Health and Counseling Services, as well as how your student can access us. And then in the second half, Marcy Hochberg, who's sitting over there, who is our Student Health Insurance Coordinator, will talk with you about basic issues related to insurance. And then at the end of that, I'll come back up and we'll answer any questions you have about anything any of us have said, either of us have said. Okay. First thing I want to put up here is our mission statement. And I put this up here because I've been here for 3 years, since 2011, and in that time, we have been continually gathering feedback from students themselves and trying to listen to what they say is important about healthcare services that we deliver to them. And we've crafted that into a mission statement. We wanted to make sure our statement reflected what was important to them. And I want to point out the last 3 lines are the key here, and that is, we want to offer student health care that includes superior customer service, superior student education, and superior access to programs and services. And this is really intentional and specific. Around the issue of clinical care, you know, we're at a tertiary care medical center, one of the top medical centers in the nation. The clinical care when a student and a provider are in a room together really is pretty good. But where in the past we have fallen down and have needed to improve is around customer service. So how easy is it for the student to call up and get an appointment that works for their schedule? How long do they have to wait in the exam room for the doctor to show up? How thorough and quickly do the physicians follow up with them on the results of tests that are done and treatment plans, things like that. That's where we've been working really hard to improve the quality of the care we deliver. Education, we really believe here part of our job is not just to educate students about how to use our system, but how to be actually informed consumers of the American healthcare system when they graduate. And then finally, access. Again and again and again, we have heard from students, this is the thing that matters most. Students of college age are most generally healthy, and so when something pops up, it's usually an acute issue. Students do not want to hear when they call up that I'm feeling pretty lousy, and yes, we can see you in a week and a half. So we've worked very hard to have acute access for acute problems, and we'll talk about our service standard in just a minute. This slide just throws up, about 2 years ago, we had an all-staff retreat, and we identified the values that we feel we should embody in every encounter we have with students, and you just see them listed there and not in any order of importance. They're all equally important. Again, all based on what we have heard from students is important to them. Okay, practically, where are we? So Student Health and Counseling Services technically consists of 3 separate services. There's the Student Health Service that takes care of medical issues, Student Counseling Service that takes care of psychological and or emotional issues, and then Health Promotion and Wellness, whose job it is to educate and promote healthy behaviors that prevent disease before it pops up. And we are unfortunately currently in 3 separate locations. We plan ultimately to be co-located in one building, but that's a couple of years away. So if you look at this map, the street that's right outside here, this is 59th Street on the Midway Plaisance, and on the map, that's right here. So we are sitting right about here. The health service is here. In our hospital building, which is really a Byzantine labyrinth of a maze, we actually recommend that students come in on the 59th Street entrance. If they come in at other entrances, there's unfortunately the possibility that we will have to go out searching for their cold, dead body at some point. So we really encourage you to come in there, and there's an information kiosk right there. We're literally right around the corner to that entrance. The Student Counseling Service, which is way up in the right-hand corner at the corner of 56th and Woodlawn, they just moved. It's a new location, beautiful building, lots of light, really a happy, healthy place. And then down south of the Midway in the yellow, you can see at the Woodlawn Social Services Building is where Health Promotion and Wellness is located. They actually have space on site where they do, they have programming available there, as well as they go out into the entire campus community and do programs all over the place. Also co-located in the Woodlawn Social Service Building is our health insurance office. That's where Marcy, who is our employee, the University of Chicago's employee, whose job is to help students manage all issues related to insurance. But we also have 2 employees from United Health Insurance, who is the insurance company we have partnered with to provide student insurance. They're also located there, and all 3 of them are available to answer questions and help students sort out issues. Okay. I want to just give you guys a little bit of an idea about how busy we are, and if you look on the left-hand part of the slide, you can see the Student Counseling Service. For last year, we saw just about 13,000 visits, and to put that in perspective, there are actually 12,000 students who pay the student life health fee, therefore are eligible to come see us there. On the right part of the slide, you can see the Student Health Service, the Medical Service. The total visits was just under double that of the Student Counseling Service. That's because the type of problems that we see in the Medical Service are obviously different from that of the Counseling Service. So we see patients for 20-minute appointments in the Medical Service as opposed to 50-minute appointments in the Counseling Service. So I want to tell you a little bit about the Counseling Service. This just gives you an idea of our staffing model. There are 7 psychiatrists, some of whom are part-time, so it ends up being about almost 5 full-time psychiatrists, social workers, psychologists, clinical trainees, and administrators. The reason I threw up the slide is to point out that we're very psychiatrist heavy compared to many other student counseling centers in America, and that gives us a particular advantage that I'm going to talk about in 2 slides. This is a poster that you'll find up in our waiting rooms, in our exam rooms. This is to advertise a student satisfaction survey that we began last year, and we send this out to all students when they come to see us to get their feedback about how we did. We really care to hear from students about how we're doing, and in fact have made many changes to our services and improvements based on feedback we've gotten in the past. We read every single one of these. We even give students the opportunity to identify their provider by name and write comments about them. And we're looking specifically for patterns. When any one student makes a comment about any one provider, you're never sure if that's more about the student than it is the provider. But when multiple students say the same thing about one provider, that becomes an important data source that we can use to give feedback to that provider. And in fact, we've done that, and we've seen that make a significant difference. Here are the results from the last quarter of last year. It's probably hard to read some of the categories on the left-hand side, but they include things like your confidence in this clinician's ability to provide optimal care, the amount of time the clinician spent with you, all the way on down to the professionalism of the clinician. If you look on the right-hand side of the slide, you'll see in the green the percentage of students who rated us either that they were satisfied or very satisfied in these domains. Now, I put this up here not to pat myself on the back and tell you what a great job we're doing, but to point out that when we initiated this survey, the stats were lower. We are hovering around 89, 90%. And 90% at that time was my target, but as we responded to student feedback and really made changes in our services, these are the numbers that they climbed up to, and so now my target is 95%. I figured there's going to be 5% of any group you're never going to make happy, and so going after them is probably going to be unrealistic, but 95% is really what we aim to do. And I'm telling you this to know this is the standard to which we hold ourselves. So here's what we do in counseling. The first bullet point is actually arguably the most important. There is no waiting list to be seen in counseling service. I point this out because, in fact, we're quite unusual this way. Across the country, in most counseling services and most universities, there is a waiting list, which means if your student calls up our counselors and says, I'm really having a hard time, I think I'm really stressed out, or I'm incredibly anxious, I need to see somebody. And many other universities, they're going to say, we'll be happy to see you in about 4 to 6 weeks. We don't think that's appropriate or acceptable, so we deliver or devote a lot of resources to being able to say, we can see you next week. And in fact, if the student says to us, I'm really in a lot of trouble, I don't think I can wait till next week, we're going to say, why don't you just come in right now? We're going to see you if you really need that kind of attention. We have 24-hour, 7-day-a-week emergency call. It's actually tiered, so we have a psychologist who's on call, who has a psychiatrist who backs them up, who has Dave Albert, who's my director of counseling, backing them up. The services we provide are pretty straightforward. We make diagnoses, so if somebody has bipolar disorder or depression, anxiety, whatever it is, we'll make a diagnosis, and we provide brief psychotherapy as well as referral services. And so I want to explain what that means. In order for us to devote the resources to continue to maintain no wait list, we are unable to provide long-term therapy in our counseling service. So if if your student has been thinking they need to talk to us about their relationship with their parents, for example, some long-term issue, when they come in for the intake appointment, we'll assess that, and if we can tell immediately that this is going to require long-term therapy, it's not urgent or emergent, we will refer out to a network of providers in the Chicagoland area, and the insurance will be charged, and there'll be a copay for the student, but the copay is only $10 per visit. What we're really in the business of doing is getting students back on their feet when they are in an urgent situation or an emergent situation so they can thrive academically. And so we aim to provide services briefly. Despite the fact that every year I stand up and say there is no prescribed session limit, the myth does persist on campus that there's 6 sessions, and 6 sessions we say, I'm sorry, time is up, you have to go and be referred out. We don't do that. 6 is around the number it ends up being, but invariably that is a negotiation, or I should say a discussion, between the student and the counselor about how things are going. Sometimes, in fact, a lot of the times, 6 or 7 is about right. Other times, issues pop up, and by the time they get there, there's a discussion between therapists saying, it seems as if you would benefit from a longer-term therapy. This has uncorked some issues. So now we're going to refer you into one of our community healthcare workers. Your insurance will be billed. We provide individual treatment, obviously, but also couples counseling, as well as we run some groups for issues that make sense to run groups for. Medication management. So if you recall 2 slides ago, I pointed out that we have a heavy complement of psychiatrists. That enables us to do something that many other counseling centers can't do, and that is considering just how many students nowadays are coming to school on antidepressant medication, anti-anxiety medication, stimulant medication for ADHD, ADD, even antipsychotic medication. Medications that are allowing students who could never have made it in college and thrive there to now come and actually thrive and graduate. But those medicines often require management themselves. Sometimes blood levels need to be drawn. And so that needs to be monitored by an MD. And we have those MDs here so that, in fact, if your student is on a medication that requires management, we can do that in-house without referring the student out to providers in the community for the 4 years here for free. You've paid for it in the student life fee, which is billed with the tuition, so we will see them for that. Let's Talk is a program we stole from Cornell University. This is sort of the Charlie Brown, Lucy, sort of the psychiatrist in model, where unfortunately in 2014, there still are many barriers to students seeking mental health services. There's a stigma that attaches to that type of issue for many people. We're constantly thinking about how can we lower the barriers to getting students the care they need, and this is one of those ways. So at 3 locations around the campus, we staff these little clinics with a therapist who is just literally sitting, waiting for any student to walk up, sit down, don't even have to give their name, and just begin talking. And it may be that the student, they're not sure they've got a problem, maybe they should go to counseling, I don't know, or I'm just not feeling well, whatever it is, they will begin talking with them immediately. We know that this actually works because a significant number of students who end up going to counseling are funneled through the Let's Talk program. So we're in fact looking to expand that this year to make it even easier for students to get the support and help that they need. And then finally, the Academic Skills Assessment Program. This is for students who are having trouble studying. So if they have a problem with procrastination, they have a problem with organization, with study skills, concentration, whatever it may be, we bring them in and we will tutor them and try to help them function better academically. As you might imagine, not infrequent number of times, that issue ends up being an emotional issue like anxiety or depression. We will often make those diagnoses for students who are coming in thinking they need help with studying skills. Okay, so I'm going to shift gears now. I want to talk with you a little bit about the student health service that takes care of the medical problems. This is our staff. At the bottom of the slide, you'll see that we have 11 direct care providers. Unfortunately, this year we're down a little bit. We've had 2 providers leave, one of whom was part-time, so we're actually down 1.5 providers. So that's a bit of a struggle for us. But as I said in the last session, I think the most important thing I do as the assistant vice president is hire really good people. And so I don't just throw anyone with a pulse into these positions. They've got to really be interested in student health and clinically excellent. So we take our time finding good people, but that unfortunately makes it more difficult for us to get folks in quickly. Here is a slide of our satisfaction data in student health, and the questions are a little bit different. Things like how well the provider addressed my concerns, length of time the provider spent with me during the visit, all the way on down to wait time in the exam room to be seen by the provider. As you can see, again, on the right-hand part of the slide, in green, our satisfaction scores for students are either satisfied or very satisfied in those domains. Again, except for the bottom one, wait time to be seen in an exam room, we are just about always hitting the 95% mark. I think the explanation for why we're a little bit lower in the bottom category can be found on this slide, and I'll get to that in just a minute. But to tell you, to start actually with the second bullet point, what is our acute appointment service standard? So we are a phone-in clinic. If you have a problem, the student is to call us, and when they call us, our standard is that we will get them an appointment in student health within 24 hours. Our actual goal is to do that within 12 hours, but our standard is within 24. Now what happens a lot of times is the student calls us at 8 o'clock in the morning and we say, well, we can see you at 1 o'clock. And the student says, 1 o'clock doesn't work for me. Do you have anything else? Well, we could see you tomorrow at 11. No, I got an intramural practice then, I can't. Do you have anything else? Well, we can see you on Friday. And the student complains, they couldn't see me until Friday. So we understand that it is inconvenient to be sick. It is inconvenient to have to come to an appointment that coincides with some other thing you have to do. This is part of our expectation that students begin to prioritize issues in their life and recognize that none of us like to be sick. But we also recognize that a lot of anxiety attaches to the notion of having to skip a class or take time out of your day when you need to be studying to come and take care of a health problem. So last year we instituted the last bullet point, which are walk-ins. Now we do this on Monday through Friday. You still have to call, but the way it works is if the appointments that we offer you within our 24-hour service standard are not convenient or for whatever reason don't work for your student, we will offer them the opportunity to walk in. We reserve a certain number of slots in the walk-in clinic every half day, morning and the afternoon, but it is a first come, first serve process, which means when you come in, you're going to probably have to wait. Now, most students actually love this because it adds flexibility to their schedule. They can bring work with them and read or do whatever it is they need to do while they're waiting, and it's been very successful and popular with students, so we're going to continue that this year. We also, this year, have Saturday hours from 9 to 1. That's a new thing that students love, to be able to come when classes are not scheduled. And then finally, in the first bullet point, after hours, we have a nurse advice line that students can call at any time of the night or after hours when we're closed and get triage advice. It may be anything from take 2 aspirin, call me in the morning, to go and make an appointment in student health tomorrow, to you better go to the emergency room. And hot off the presses, we're actually looking to upgrade this to enhance these services and probably turn it from a nurse advice line into a physician advice line. We're hoping that's going to be coming sometime later this quarter. And then health promotion and wellness. So this is the third arm of student health and counseling services, and the goal of health promotion and wellness is to educate your student and promote behaviors that hold off illness and promote their academic flourishing by preventing problems before they occur. So how do we get students to get adequate sleep? How do we help them quit smoking? How do we help them exercise adequately? Those are the challenges that health promotion and wellness takes on. And they have a lot of programs that they put around during the year around campus, including some that you see here. One I always like to point out is the second one, Pet Love. We actually bring in dogs that the students line up to pet, which they love to do. They're going to want to come and pet the dogs. In fact, last year we had 1,000 students line up to pet the dogs. And what's interesting is this is not just this fluffy thing we like to do to make them feel temporarily happy about life and petting a dog, which is good for us all. But it turns out that there's some evidence or some thought that it actually promotes a sense of community. And further, that sense of community may actually help promote health-seeking behaviors. So what we're actually doing, being the University of Chicago, is studying this. We have a number of anecdotal reports of students who came to Pet Love in the last few years who then, say, directly went from there to counseling and had been resisting going to counseling. So we're thinking that if we can show that, fluffy sort of things like this actually do more than just make people feel good temporarily, it's worth us expanding and investing in that opportunities. We also have a number of student groups that students who are interested in helping become part of what we do and promoting healthy behaviors can join. Anything from stress busters, where students give other students clinically appropriate massages. Then we have things like the UChicago Body Project that helps people deal with body image issues, peer health advocates who help educate other students in a whole variety of health issues. And then finally, we have this, which is the Resilience Project. This is sort of my little baby. This is a series of workshops we give throughout the year, a total of 9, 3 per quarter, based on a book that I wrote called The Undefeated Mind, the thesis of which was the following, that resilience is not something you are either lucky enough to be born with or unlucky enough to be born without, but something that actually can be taught. That is, resilience can be learned. And we actually, this is the third year that we are putting the program on, and the last year we actually studied it and used validated psychometric instruments that were in the psychiatric and psychological literature to measure both resilience in students as well as levels of anxiety and depression. And what we found, when compared to a control group of students who came to a health promotion and wellness event, but were not interested in signing up for the Resilience Project, but submitted to taking these survey instruments along with our experimental group, that not only did the students who took the course show significant increases in their resilience, but actually when it comes to anxiety and depression scores, cut them in half by 50%. In fact, even went below the levels of the control group that, as you could imagine, were hardier and less anxious and depressed at the onset than our experimental group. So we're really excited to bring this to even more students this year. And if anyone is interested, if you have a student who's interested, if you go to our health promotion and wellness website at wellness.uchicago.edu, you'll see a link that will tell you more about the program and give your student the ability to sign up. We're looking for as many students as want to sign up. We do it from 4:30 to 6. It's only 3 sessions a quarter. We feed them dinner. So the students in past years have not found it to be too burdensome and have really liked the program a lot. So we're excited about that. All right, so what I'm going to do now is hand the podium over to Marcy, who's going to talk with you about the fascinating topic, yet important topic of insurance. And when she's done, I'm going to come back up and take your questions about anything that either I have said or Marcy has said. So once again, I want to thank you for your attention, welcome you to the University of Chicago, and hand the podium over to Marcy. Thank you.
Good morning. Thank you. My name is Marcy Hochberg, and I'm the University Student Health Insurance Coordinator. And thank you for your time this morning. So I want to talk to you a little bit about the university's insurance requirements. And if you're with me, then no one understands health insurance in America. So let's talk a little bit about what we require and hopefully demystify this a little bit for you. So the university requires all students to have adequate health insurance, and I really do need to fix this slide because in light of the Affordable Care Act changes, we really do require all students to have good health insurance. So to that end, one of the things we've done is we've gone and enrolled all of your students in the University Student Health Insurance Plan, which I'm going to start referring to as USHIP because it takes too long to say University Student Health Insurance Plan. It's just way too many words. So that is the student insurance plan, but what you need to do is make a decision regarding whether you want your student to use the student insurance plan, which is a great plan, and I'll talk to you in a moment a little bit about some of the benefits of what the student insurance plan provides, or if you've got good insurance coverage, which I'm sure many of you already do, whether you would prefer to have your student waive their enrollment in the student insurance plan and stay enrolled in your insurance. If they're going to waive enrollment, what you need to do is check and just make sure that your existing insurance meets the university's comparable coverage requirements. In most cases, I'm sure this is not an issue because of the changes with regard to the Affordable Care Act. Almost all of you should have an ACA compliant plan. So in that case, for most of you, that means your plan is going to meet those 10 essential health benefits. There's a couple of other additional requirements we're going to ask you to meet to make sure that you've got that good insurance and that your plan is going to provide for coverage while your student is here on campus. And we do have a comparable coverage checklist on our website that you can download to make it easy for you to find that information. I'm also here as a resource, and we've got 2 United Healthcare representatives to assist you with that. But if you go to studenthealth.uchicago.edu/insurance, that'll take you to the landing page for all of the university insurance information and assist you with that assessment. One of the things you're going to need to do is help your student make that decision before 5 p.m. Central Time on Friday, October 24th. And I'm going to encourage you not to wait until that time. If your student is going to use the university plan, we encourage them to confirm their enrollment in the university plan as soon as possible. Although we've enrolled them in the university plan, their data is not active until they go and confirm that enrollment. Once they've confirmed that enrollment, and they would do that at studentinsurance.uchicago.edu, it takes about 48 to 72 hours for that data to be moved to United Healthcare's system and activated, at which point they're able to then access their insurance benefits in USHIP. If they're going to waive their enrollment, again, they're going to go to that same website, studentinsurance.uchicago.edu. This is our enrollment waiver application site, and they would go and select waiving their enrollment. We're going to ask a number of questions, so we ask that you work with your student to have information about your plan available. They're going to have to provide information about the policy holder, their member ID number, their premium information, deductible information, out-of-pocket information, and answer a number of questions about those benefits. So again, download the comparable coverage checklist, help your student have that information prepared and available. And I apologize because at the moment, my form is not saving that information if you've entered it. So if they start to enter it and they don't have everything ready, and then they come back, they're going to have to enter it again. So let them have all that information available to them and do it once because it's a pain to enter this stuff twice. Again, it's confusing. So Dr. Lickerman mentioned that your students pay a student life fee. So let's talk a little bit about what that means, the student life fee versus your health insurance. So the university assesses a student life fee for all registered students, and this provides students with access to student health, student counseling, all of those great health promotion and wellness events that we really encourage students to take advantage of so they don't have to get sick and so they maintain their mental health and balance. But again, once that student life fee is going to cover their access to primary medical and mental health care. So if they get that chest cold, if they slip on the ice, and we just had a heck of a winter that we got through, and we're really hoping we don't have another winter like it coming up. But if they decide that they actually need some short-term help with their study skills, again, this is all covered by the student life fee. However, should they need a prescription, should they need to go see a specialist, this is when their insurance is going to kick in, whether it's UChip or whether it's your private insurance. So we want to make sure that they understand how they're coordinating their benefits in order to be able to use the right service at the right time. If your student is using the university plan, we also want to make sure they understand that we want them to start at student health or at student counseling. Because if they're going to be using the university plan, they need to get a referral first from student health or student counseling in order to avoid a $50 non-referral fee. So for example, if your student has allergies and they would benefit from seeing an allergist, they need to start at student health and get a referral for that allergist. Once that referral is in the system, that referral will stay with them for the life of their time on the university plan. So next year, if they remain on UChip, they don't need to get a new referral. That referral is in the system. That is there for the entire time they remain on the plan. But if they do not get that referral, they will be charged a $50 fee each time they go to see that specialist. So we want to ensure that they do follow those benefits and use them accordingly. There are some instances where a referral is not required, and we encourage students who will be using the university plan to download a copy of the policy guide. This will help direct them to when they need a referral, when they may not need a referral. For example, obviously in the case of an emergency, if they need to go to the ER, there's no referral needed. But again, we encourage them to get familiar with the plan so that they can access their benefits accordingly. So one of the things that I've been doing over the last few weeks and will continue to do over the next few weeks is work with your students to start to increase their understanding of insurance. And so what we work with students to do is to start to become knowledgeable about their insurance so they have a just-in-time understanding. The Student Health Insurance Office really takes our role very seriously to help your students start as they start to developmentally transition into becoming adults, to start to understand that it's important for them to really begin to learn how to use their insurance as adults. We understand that in many cases you may still be paying that premium, paying that deductible, paying for many of their medical costs, but the more they can start to understand how they're interfacing with their insurance and how to understand researching these terms and using this insurance, even if they're not necessarily paying for all of those costs quite yet, the more they're going to be able to be educated consumers of their insurance. So part of what we've been doing is helping them understand a few key terms and understand what this means when they're using their insurance. So again, the premium, what they're paying to actually buy that insurance. For many students, when they first get that initial explanation of benefits, they don't realize that there's a deductible that has to be met before their insurance is actually going to pay for any of their medical costs. Understanding what that annual out-of-pocket maximum might be. So recognizing that as they're looking at different alternate plans, beginning to look at the interplay between the premium cost, the deductible cost, the annual out-of-pocket maximum, so that they can research alternatives and make the best choice for themselves in terms of considering what might be the best fit for their particular needs. So some of what we do is we help them understand these terms as they apply to the university plan. So again, for many of you who've looked at the university plan, you see that premium cost. And it's, we charge you quite a bit to purchase the plan. And part of it is that upfront cost is getting you some pretty wonderful benefits. We have a very low deductible on the student plan, $200 for in-network providers. So when students actually are needing to use their insurance benefits, there are very low costs associated with the student plan. Similarly, the out-of-pocket maximum on the student plan is $1,500. Now, for those of you who are familiar with the changes for the Affordable Care Act, for individual plans, that annual out-of-pocket maximum is up at $6,350. So you can see there's quite a difference if you actually need to use your insurance, where you're going to meet that maximum on the student plan, and where the plan is going to start paying 100% in contrast to some alternative plans. And again, the plan pays 90%. One of the changes we instituted this year as well is we added a copay for doctor and specialist visits. We got a lot of feedback from students where they indicated that because they have a coinsurance of 10%, they did not know how to manage some of their medical costs. In this case, now when they're going to see a doctor or a specialist, they know it's going to be a $20 copay no matter what. So this was one cost we knew that we could set and have a fixed cost for them that they knew they would be able to manage. So one additional thing we provide for them is a means of then being able to assess alternate plans. I went on the Illinois Exchange, and now I'm no longer 26, but I pretended to be a 26-year-old, and pulled up a silver plan, and also looked at what the cost would be for this ISO Care plan as a popular plan available to some of our international students. Again, I apologize to those of you who have domestic students here at the university, but we have some plans that are available only to international students. But we wanted to, again, provide an opportunity for students to be able to look at, when they research alternatives, when you're looking at those premium, deductible, out-of-pocket maximum costs, and coinsurance, when you look at what those costs look like, you can consider those costs, but unless you're really looking at what it means when you have a medical expense that you're facing, it's hard to think about those things on merely a theoretical basis. So we had you look at those then if you were facing a $3,500 medical bill. And sad to say, a $3,500 medical bill is a little more common than many of us may anticipate, particularly given how healthcare costs are set in America. So for an average medical bill, you see how some of those charges may pay out. One of the things we encourage students to do is to start to think, don't underestimate risk. If you had an unexpected cost, how might these costs play out? So again, we want you to consider what might be the particular needs for your student. Your plan might be the better fit, the university plan might be the better fit, but as you start to consider the premium cost, the deductible cost, the out-of-pocket maximum for your plan, think about what might be your particular student's needs. Are they cautious? Are they adventurous? Do they have maintenance medications do they need? Do they tend to, have particular chronic needs that they're going to be seeking care for? So these are some ways that you might want to consider things as you're assessing what their particular needs may be going into the next few years here at the university. I want to talk to you a little bit about some of the resources for the Student Health Insurance Office. As Dr. Lickerman noted, we host 2 United Healthcare representatives here on campus. They're here to serve as a resource in particular for the university student insurance plan. So they're here to answer questions about plan benefits, and for those students who are on the university plan, to assist with filing claims, to assist with claims appeals. For those students who are confirming their enrollment in the plan, they can assist with that. And for your students who are waiving their enrollment, they can assist with your students helping to waive enrollment as well. So they're here on campus in the Woodlawn Social Services Center, again, just a little bit south of the Midway. My office is right next door to theirs. And so if your students are having some challenges working with the United Healthcare representatives, they can also come and touch base with me as well. For those students who are on the university plan, we encourage them to set up an online My Account. United Healthcare has gone green in the last couple of years, and what they offer is this online account to enable your students to download their insurance ID card, or even better, United Healthcare has a mobile app that your students can just download right onto their smartphone. In that way, they can have their insurance ID card available to them right on their phone, so it's with them and portable no matter where they are. The online account also enables them to check network providers. So when they're home, if they're on the plan, they can check a provider in your area. They can check claim status. They can locate pharmacy information. And it's a convenient way that they can have their information with them just in time, no matter where they are. For those students who might be interested in getting additional dental coverage or vision coverage, the university doesn't officially sponsor these plans, but we do provide information about plans because we do know that parents and students are interested in getting additional optional coverage. So Delta Dental of Illinois and United Healthcare offer a few different options with regard to dental coverage. Delta Dental has an HMO plan and a PPO plan. And one of the benefits Delta offers is that students can sign up for these plans either for the full year on a 12-month basis or just for a 6-month period. And then again, they'll have another enrollment period in the spring for another 6-month period. United Healthcare's plan is more of a low option plan. So if students are really looking for something that's going to provide them with cleanings, the occasional filling, it's priced accordingly, but it's a low benefits plan for students who are not thinking that they may need extensive dental work available to them. Delta's plan additionally offers students the option to switch between the HMO and the PPO, which is an additional interesting other benefit that they offer. We have a choice between 2 vision plans also. Both of these are vision PPO plans. They offer an annual eye exam for a $10 copay, and both of these plans are structured a little differently as far as how they offer eyeglass frames, lenses, or contact lenses. We have additional information about both the dental plans and the vision plans, including summary of benefits information. All of this is available on the student insurance pages. Again, studenthealth.uchicago.edu/insurance, and extensive information about premiums is available on the dental pages and the vision pages for those of you who want more information about any of these plans. I'm going to turn it over now, and if you have any information about student health, student counseling, health promotion and wellness, or student insurance, we'll be happy to answer any of this for you. Thank you again for your time and attention.
Yes.
I have a number of insurance coordination questions.
Yes.
So thank you for all of that information. Question number 1, the premium for USHIP, was the first installment already included in billing that was sent to parents for tuition, student money, and other things?
So the initial billing for the USHIP premium is typically included on the pre-bill. However, if you have waived any time between August 25th and September 19th, that should have dropped off over this past weekend because the bursar would have done another assessment, I think, over the September 19th, over this past weekend. So that should be off your bill. Now, anyone who's waiving those charges should come off of the bill within about 48 hours.
Let's say that someone wrote the check for the full amount of the bill, and so now they elect to waive it.
If you subsequently waive and you have since paid for the insurance premium, you will see a refund on the bursar bill within 48 hours. You may need to check with the bursar if you want to request that that money actually be refunded to you rather than sit as a refund on the bill. Yes.
Okay, second question then. Let's say that the student waives because there's viewed to be an adequate form of insurance from another source, such as a parent, employer. If they come over for a choice to stay at the healthcare service or use the nurse advice line, is there any fee for that?
No. No, that's covered by the student life or student health fee, which is included in tuition.
So when they're actually either receiving services from the University of Chicago medical providers or other providers in the, say, Chicago community, that's when we are operating on insurance?
So what the student life or health fee covers is all visits to us and some routine labs, the most commonly checked labs. So a number of visits actually never generate a bill to the insurance company at all. But if the student needs to be referred to a specialist, if they need certain types of lab testing or x-rays or procedures, those types of things are what are billed to the insurance.
And dental care, is any dental care provided?
We don't currently actually provide dental care. There are dentists in the community who students can see. We're actually working on affiliating with dental care because it's actually something students are telling us they would like. So we're working on that.
Right. So all the questions really about the finances of insurance, co-pays, deductibles, out-of-pocket maximums, etc. predominantly when the student is seeking medical assistance outside of what your office, the healthcare office?
Not exactly true, because we order quite a few studies that insurance companies will be billed for, and so students often ask us, how much will this cost me? And they will actually have a copay or a co-insurance depending on what insurance they have. But we work with them to help, understand what their specific charges will be.
So when they waive and you've got then the information as to what their copays, deductibles, maximums are on the other plan?
No, we would, but often we help, our coordinators in clinic will help contact the other plan to find out what the cost might actually be to the student. We'll often do that so the student understands as best they can what their charges are going to be.
Sure, but there's at least coordination as between whatever it is that your office needs to go to the other insurance provider. That way it's...
Yeah, we will bill the other insurance provider. We'll do all that. We expect students to have some knowledge of how their insurance works, but yes, we coordinate that. We do, yeah. Yes? You, yeah. No, you can take that one. Yeah. Yeah. Go ahead. How do I answer this? Yeah, this is an issue that has come up, and we are now looking at in the unlikely event that your student would be. This is for the foreign soil.
Well, no, it's domestic.
Oh, domestic. You'll have to answer this one.
All right.
Yeah. Gotcha. Yeah, go ahead.
Okay, so I'm going to answer this probabilistically because it's never a fun question, especially in a room full of parents. And this is a requirement that has come out of our risk management office. So let me start with the medical evacuation side of it because that one's a little easier to tackle. We want to ensure that no matter where your student may be, if they go off campus, if they go hiking up in the Wisconsin Dells, if they are in an area where someone slips down a hill, that we can ensure that they can get evacuated to where they can get care, and this coverage is provided in your insurance. One of the interesting issues we find is that in most employer and individual plans, medical evacuation and repatriation is not a typical coverage. It is a typical coverage included in student insurance plans. The repatriation piece is a little more grim for me to especially talk to a room full of parents about. And this has more to do with when we're talking about bringing a student's body back home. And this is where we actually are looking at reevaluating this requirement and may be able to make some adjustments for next year. However, part of this is because we have a very international university and our students end up with these wonderful academic opportunities that sometimes arise without warning. And so what our risk management office had asked us to do is to have this requirement including for domestic students, because should there be an opportunity that arises where students' insurance does not provide for this, but there might be something that comes up that may be unanticipated, they wanted us to provide for a hypothetical. We are re-examining this at this time to see if we can provide some other way to try to address this requirement to make it less onerous for parents.
My practical question is, if my insurance or our insurance does not include this, do we then have to buy it separately if we're waiving the shipping?
So yes, and we have located an alternate plan that we are recommending to parents that is available for about a $60 annual fee that we hope is not too onerous, that we are suggesting that students purchase as a supplemental coverage that they can then add on to their existing plan to meet the requirement. We have a link on our page that enables students to find that, so students and their parents.
It doesn't accept the waiver if you click on it, your insurance doesn't cover that. So like my waiver was not accepted.
Well, it is a requirement, so what we would ask you to do is...
Repeat the questions thing.
So if you have answered no to the waiver requirement, your waiver will be denied. So one of the things we're asking parents to do is, if you pick up the supplemental coverage, to then answer yes to that waiver requirement. The limit on the form right now is we recognize that there isn't an ability to put in primary and secondary coverage. So we're going to ask you simply to fill out the form for your primary coverage. We trust you all. So once you have picked up that secondary coverage, you will be able to answer yes. And so resubmit the form answering yes to the coverage, and the form will then be accepted.
As is the norm throughout the country, come every fall, many of us get a re-evaluation of our employer-provided health insurance. And so I have completed the waiver. I've blocked the writer for the extra medevac. But I know that my employer is going to provide me with new insurance, and I don't know all of the exact specs of it. What happens if come December, I'm looking at a different plan, and I've already done the waiver, and now I'm like, oh my gosh, now I'm not within compliance. How do you address that kind of situation?
So one of the reasons we do ask students and parents to update their insurance information on an annual basis is we do recognize that almost every plan has an open enrollment period and some annual changes. If you encounter a change that might make substantive changes to your insurance, we simply ask that you contact your on-campus insurance office at that time.
And I have a follow-up on that. If you had, if, you know, there's in-plan and there's out-of-plan, if I have done the search, and I know in the Chicago area there are many doctors that are in-plan, but you are then, through student activities, referring to, will your offices actually look for an in-plan doctor to refer to, given a very standard Blue Cross Blue Shield kind of umbrella, where the umbrella is quite broad, you know, assuming that it's not an obscure issue.
So the physicians will not, but the clinic can. By that I mean, we typically think, we make ourselves insurance blind most of the time, and so if we think you need a subspecialist, we typically refer to who we think is the best. It is really the student's responsibility to say, not all physicians in this hospital, or maybe even U of C, are in network in my plan. I need to go to Northwestern, or I need to go to some other, and then we can make those referrals there, but the student needs to alert us that that needs to happen. You had a question there.
Yeah, we're not from the U.S., so we don't understand really how this works. It's just for normal, like the flu or diarrhea or whatever.
Yep.
So if the student goes to this health center, they have a copay.
Yep. No.
$20.
No. So the student health fee, which has you've already paid part of the tuition bill, gets you free visits to the student health service and the student counseling service. So that also covers routine labs. Immunizations are covered. Insurance is invoked when either you need an unusual laboratory test that is not usually ordered, or you need an x-ray of some kind, or a referral to a subspecialist, or say surgery, or an inpatient admission to the hospital. But to visit us is covered, free, no copay. No, so medicines are not, so it depends on the insurance. So with the student insurance plan, there's a copay, and if you are not on the student insurance plan, it depends on your insurance. We don't dispense medicines, we will prescribe them. So there usually is some type of copay with the medications.
So when the student goes, like with the flu or fever or something, the health check is free?
Yes.
They should carry money for buying the medicines that they prescribe?
Yes, so if you're you need to pick up a prescription, there's a copay in. Yeah, usually, yeah. So if you're going to go to pick up a prescription, there is usually a copay. The student will be financially responsible for part of the charge of the medication. Yes, but for the visit and anything we do, most things we do, that's covered. Yes, back there. Yeah, so there are times when the student, they may not need to come and be seen. Like, for example, it's a chronic condition and you just need to sign up with a neurologist here. If you call us and ask to speak to our clinic manager, we can often provide those referrals without the student having to come visit us. But if it's a new issue, They can actually just call the student health clinic as if they were going to make an appointment and explain the situation, and we'll work with them. Yes?
This question regards to how the transition works. Like, a student goes to your house provider for a home or a school involved and then for somehow needs medication that his private, his insurance will pay for it. How is the doctor to prescribe the prescription for him, or does he have to go to his own?
No, we will prescribe, we will take care of the entire medical care, and so we will send the prescription, for example, to the pharmacy of your student's choice. The pharmacy will do what they normally do, which is bill the student's insurance and collect the copay. And that's the case, and we are a full-service medical clinic, and we take care of everything, and we will bill insurances as well if there are tests that need to be done that are not covered by the student health fee. Yes? Yeah, so your best first step if they get physically sick is to call the student health service for an appointment. We will make the appointment and actually even begin to triage their complaint on the phone so that we can, if something really serious is going on and we think they need emergency care, we'll direct them there immediately. But your basic first step is call us and we will bring you in and we will take care of whatever needs to happen. Yes, the University of Chicago Medical Center. We are part of that, and we actually work with them and work with all the specialists there.
How can I find the doctors? Are they using my estimate of their insurance?
In general, insurances qualify groups of doctors. So University of Chicago Medical Center, you don't have to name an individual doctor. You can just say, will your insurance cover visits at the University of Chicago Medical Center? And they typically cover all the doctors there. It's on our website. We don't have the flyers here, but if you go to the Student Health and Counseling Services website, that number is on the front page. Sure. Yes?
Does the insurance cover
OCD? So the insurance will cover referrals to a psychologist or a psychiatrist for all psychiatric diagnoses, yes. So we treat OCD in the counseling center as well, but again, if it's a long-term thing and it's not just medication, we can manage medication for a student who's on OCD medications, but if they need long-term therapy, we refer them to a psychiatrist or psychologist in the community, and then that would be billed by the insurance, or the insurance would be billed. Yes? Yes. Yes. Yeah. Yes, so if your student needs blood work done in order for even a provider at home to prescribe medication, we can easily do that. So if they just call the student health service and ask for an appointment and come in and explain to the doctor what blood work he needs. Yeah. Okay. Oh. Yeah, no. So one of our physicians will have to place the order in the system. So where your student should come is to the student health service, make an appointment to see one of our providers, and he can hand the order to our provider, and our provider will put that in our system. We will draw the blood, and then we will get the result and fax it to your doctor at home.
And we pay the university insurance, and we have our own insurance plan.
Sure.
So does he have to give that insurance to you guys?
Yeah, so right there, he'll have to have, because the insurance, depending on what the blood levels are, the blood tests are, if it's not covered by the student life fee or student health fee, that we will bill the insurance, we'll need that information. Yeah. There's not a pharmacy at Student Health, but there's a pharmacy a building away in the first floor of our DCAM building. So there is pharmacy right on campus, and many students use it because it's very close to where we are. But we can send it to any pharmacy that the students ask us to. Yes?
Yeah, you mentioned about Northwestern being an option for some insurances. If a student goes to emergency room, I'm assuming they're automatically going to send them to Chicago's emergency. But if the student wants to go to Northwestern, how do they transfer?
So it depends on how the student is being transported. So if an ambulance is called, in general, their protocol is to take any patient to the nearest emergency room, presuming it is a real emergency. If the student wants to transport him or herself, they can go to whichever emergency they want, again, depending on their insurance. Like if they have student insurance, there's a $50 copay. But in general, the real emergencies that require ambulance transport, the students on campus, they'll come to ours. And if it's not a real emergency, often we encourage them, if it's after hours, to call the nurse advice line to get advice about whether it really requires an emergency room visit and what urgency they need to be transported.
And then also, do you have like any advice on where to go if you want an acupuncturist or a chiropractic?
Yeah. Is there any advice about acupuncturist or chiropractic? We do have some. We have some knowledge of local people who do that. For some of those things, we have listed in the Student Health Service. So if they're interested in that type of thing and they want to learn about it, they can call us up and we can help connect them with some or offer local things. Yes.
Does the insurance cover foreign students who visit the countries in summer breaks?
So I'm sorry, I didn't hear that.
Does the insurance cover foreign students who go back to their countries during the summer breaks?
So UShip, the student insurance, is an international insurance, and it will cover students across the world. But the answer depends on which insurance you're asking about. So the student insurance does. UShip does. Yeah. Yes. Closest ER is on our campus. It's actually down a hallway from where the Student Health Service is located. Yeah.
What is that called?
It's the Mitchell ER, Mitchell Emergency Room. All right, so if there are no other questions, thank you very much for your time and attention, and again, welcome to the University of Chicago.